Hi everyone, this is Dr. Chong. Today let's talk about pneumonia. Lately, a lot of people has been admitted to the hospital due to cough and they were told by their doctors that they are having pneumonia. So what is pneumonia? Pneumonia is a type of lung infection in which the air sac of the lung is filled up with bacteria. In a normal, healthy individual, you can see from the chest x-ray, the lung feels supposed to be black. However, sometimes you are able to see white patches over the lung field of the chest x-ray. So this might indicate that patient is having lung infection. Factors like your age and the type of bacteria will also affect on how our body handle the disease. Of course, people with weakened immune system, especially the elderly and the young one, they will experience a serious form of disease or symptoms, or what we call as extreme version of pneumonia or severe pneumonia. Symptoms of pneumonia such as cough and also some with a lot of phlegm or what we call as mucus. Some might even having a feverish symptoms and also some might even have chest pain. So all these are the symptoms of pneumonia. Now let's talk about the risk of pneumonia among the elderly. Being elderly means that the risk is also higher. Sometimes in the case of pneumonia, it can cause bacteria in your blood, which is a condition called as bacteremia. And also sometimes pneumonia can give you breathing problem. And in a patient with history of old tuberculosis infection, or when even they have a very poorly controlled asthma, so this might actually causing them to have a lot of breathing problem. It can also form lung abscess, in which pus can form in your lung. Of course, the mainstay of treatment for lung abscess is antibiotics, but sometimes you might need surgery to remove the pus. In a case of severe pneumonia, we might sometimes do CT scan to look at any worsening of the lung, to look at the complications such as any lung abscess forming. CT scan can provide us more information. It can even guide us on the treatment. CT scan can show whether is it tuberculosis infection or is it bacterial infection from the pattern of the CT scan. Treatment of pneumonia among the elderly is challenging. Usually the treatment focuses on treating the underlying cause. Let's say the cause of pneumonia is by bacteria, antibiotics should be given. If the cause is TB, then anti-TB will be prescribed. Of course, other than giving antibiotics, the other treatment is actually providing medication to loosen up the phlegm to help patient in expectorate the phlegm as well. And not only that, treatment should also be tailored with multidisciplinary approach. Chest physio, rehabilitation, breathing exercise, all this is very important in aiding recovery of pneumonia among the elderly. Physiotherapy is a very important treatment. It will help to remove the phlegm and also lung secretion, improve breathing and also improve the airway obstruction. Most important treatment is also family support. When they are diagnosed with pneumonia, so they will have to be placed in an isolation room. So when they are in the isolation room, often they feel very helpless and stressed. So sometimes it's very important for family member to provide family support so that they can feel more positive to fight the disease. So are they able to survive? Yes. I have seen a 92-year-old lady able to survive a severe pneumonia, but she's a healthy, fit 92-year-old lady. And yet, some of them might not make it. So sometimes it really depends on the individual factors and how their body responds to the treatment. Like I said, prevention is better than cure. Always encourage your grandparents and the elderly at home to wear a mask so that they won't catch the disease from the surrounding people. So I think that's about today. Take care.